Okay, so my agency is the Institute for Sustainable Health and Optimal Aging. And the way we define that is sustainable health is the maintenance and enhancement of environmental, social, and economic resources in order to meet the needs of current and future generations. So people do need resources, and a big component of what we want to bring in that area is education and awareness. But it's also a lot of, um, you know, public domain type stuff. So whether that's street signs where the font is larger so they can actually read it, or the color contrast is something that their eyes can make out. So sometimes older people suffer with macular degeneration or glaucoma or cataracts, things like this, where their vision isn't as strong as it once was, and so all of a sudden they're limited in their ability to take in the information that's out in their environment. So, and then the other component is, so we want to provide those resources is what I'm saying, and we're going to do that through research, education, practice, innovation, and just expanding and creating a better medical model, a better healthcare model that is primarily preventative versus treatment focused. The other thing is optimal aging. So we define that as the capacity to function across many domains, physically, functionally, cognitively, emotionally, socially, and spiritually to one's satisfaction, and that is in spite of one's medical conditions. So thrive where you are and do the best with what you have to work with is where we're coming from. So then outside of that attraction, I've always been attracted to older adults. Ever since I was a child, I can remember going into the nursing home. I had a great-grandmother that was in a nursing facility, and going to visit her, and there would be like a room set up of rocking chairs and all of these older adults sitting there, and when we would walk in, they would all reach their arms out, and I would just like go around passing out hugs, and my brother and sister would be kind of tucked up under my mother. And the other part was that my great-grandmother did have dementia, and so she would tell these stories of like traveling all over the world, and my grandfather, her son, would tell me that no, she's been at the nursing home the entire time. So I thought, in my mind, as a child, like I thought she was pretty magical and people just didn't know. So anyway, with that, I did have the opportunity to have 7 years hands-on experience as a CNA, so a certified nurse's assistant. And I did not like, I had institutional care, so the nursing facility and rehabilitation center, and I also did private service, so in-home care in their own personal space. And there is a huge difference between the two, and I love the private care component where it's personalized and they really do determine what it is that they're doing, when they're doing it, how they're doing it. You know, it's totally up to them. So and then it's a stark contrast inside the institution. So as a CNA, I would come in and I would get a list of residents, and it would list all of their health, requirements and means that they needed, what they needed assistance with, what their level of care was, what their diet was. But so I may come in and have anywhere from 12 to, I think the most I ever had was 21 patients, which obviously I would almost think that that's illegal, but I really don't know the laws on that right now. That's a lot more research. But so the protocol would be to come in, wake this person up, so they don't know who's waking them up, first off, and So wake them up, turn their lights on, help them sit up, get them into the restroom to toilet them, brush their teeth, wash their face, get them dressed. And all of this like in minutes, because you have a whole group of people that you are required to do this to. And then yes, and that's what it feels like, is that you're doing this to them. And so then you have to move them from their bedroom, out of their bed, like, and then get them down to a dining area where they have this meal served to them in an atmosphere that may not be their to their liking. You know, they may not like bright lights first off in the morning. They may not like chit chat going on, you know, around them. They may not like to get up and eat first thing in the morning, whatever. So this was kind of what it looked like, and I literally have been written up because I was moving at the pace of the older adults. So you may be working with people 60, 70, 80, 90, 100 years old, and you're, you know, you were expected to move them all at the same pace. So there's this total vulnerability that takes place where it seems as if the family is greeted with one mentality, and what's really going on looks a whole lot different than that. I also once there was a family whose mother was, she had dementia, and she was in the nursing home. Well, this nursing facility was not made out for dementia residents. So she would wander into other people's rooms, and, you know, in her confused state, she wasn't meaning any harm. She was just walking around. She may be cleaning off their table, you know, or thinking it's her brother or her mother or whatever, you know, her perspective was. And then she would be greeted with confusion because the other older adults don't understand what's going on or why she's, you know, in their space. Or some may have a little idea that she's confused, or but so, like, she actually was getting hurt at times because they would respond like aggressively or out of fear. And so I informed her daughters that the facility really wasn't made out for their mother's needs. And they went back to speak with some higher up in the building, I guess the director of nursing, and I actually got in trouble for sharing that information. So it was out of place, but it was advocating for the resident, which is what the first line is supposed to be, working with them. So there's these kind of really a lot of things that are going on that just discriminates and puts them at a high risk, sometimes of neglect because of the level of the number of patients to service worker, and so it's like this downward spiral, because even if you walk in there with the you know, with the hugest heart, like, the expectations are beyond what you can provide with that sort of compassion. It truly is. And so actually the article that I pulled from to, like, kind of support strategies to promote and advocate social and economic justice for this population is it's called Healthy Happiness: Effects of Happiness on Physical Health and the Consequences for Preventative Health Care. And basically what they're saying is that taking time to care will also give you more time to do your other responsibilities. So basically, your kindness and compassion can increase the happiness and health and progress of the patient. And it's a win-win. So if you give more time to a patient, they're more likely to try and do something more for themselves. So, and their happiness increases, which can affect, you know, depression levels, anxiety levels, stress levels. Just feeling, you know, loved. And love, we know all, well, not all, but there's a lot of research that goes back to like the wire monkey experiments where we need love to thrive and survive. So that's like a quick clip of what the Institute is trying to advocate, but basically all ages. So if you have ever been in the position of being out in public with a toddler, or you know, a young toddler that is potty training, and they tell you for the first time that they need to use the restroom, and you are in public and you try to take them, you'll quickly find out that it affects their age level too, that public restrooms are not age friendly. So anyway, that's just another example of another level, but that's what we want to do. We want to support our older adults so that they can thrive regardless of their aging. Aging is not a disease, it's a natural part of life, and it can be very pleasurable and very enjoyable, but this is we're in a system that truly we do thrive when we support each other. It's the abundance mentality versus the scarcity mentality where we don't have time to care, and we do. In fact, we must. Thank you.